everyone. Since it's Parkinson's disease, various aspects of Parkinson's. How does it happen? Is it curable? And what would happen to person after life? After he gets this Parkinson disease, what exactly happens to his life? There is so much to know about this disease itself, yet we are not sure what is true in this huge ocean of internet. Today, I have an esteemed guest with me, Dr. Pankaj Agarwal, who specializes in this space, and he will help us to bust all the myths and give us a lot of facts around this. I would request Dr. Pankaj Agarwal to kindly introduce himself now.
Yeah, hello, Meenal, and hello, everyone, and thank you for inviting me for this interview to bust myths on Parkinson's disease. I think it is very important. And just to introduce myself, I am a movement disorders specialist neurologist, which means that I specialize in Parkinson's disease and various movement disorders. And I am in the global hospitals in Parel, in Mumbai, and I have been practicing neurology for more than 16 years.
Oh, great, sir. So the first myth I have often heard about is that Parkinson's disease only affects movement. Is it true, sir?
No, so actually Parkinson's, movement is the main thing which is problematic in patients with Parkinson's, but there are many other things besides movement as well. And so this is certainly a myth that it is only movement that is affected. So if you speak with any patient with Parkinson's, they will tell you that they have problems with anxiety or depression. They may have thinking or a cognitive problem. So they may have various non-motor symptoms as well, such as constipation or difficulty with smell. So there are a number of non-motor features to Parkinson's disease as well. And this is called the Parkinson's that you don't see. So when you see a patient, you will only see tremor or slowness and stiffness in their body parts, but you will not see these other aspects such as difficulty with mood, difficulty with memory, difficulty with urination, for example, excess urination or frequency of urination, constipation, and so on.
Oh, great. So that's actually something very different from what I've heard about. Another comment that I would want to know, whether it is a myth or fact, is Parkinson's disease always inherited?
Yeah, this is a very good question that you ask, because actually when James Parkinson described this disease, he thought that it was completely not inherited. Means it was just sporadic and there was no family history in most people. But now in the last 10 or 20 years, research has shown that a small minority of patients with Parkinson's may have genetic forms of Parkinson's. It is still a minority, so I would say 10 to 15% of all patients with Parkinson's have a genetic cause and it runs in their families. But in the large majority of patients, 85-90%, it is not inherited. So it does not run in the family.
Okay, that's an important insight. Also, is Parkinson's disease caused by head injury? Like, kids playing around, should we be, very serious about all that?
So it is not really caused by head injury. Okay. Now Parkinson's, as I said, it can be caused by some environmental factors, and it is not clear what is the exact environmental factor, and a combination of your genes and the environment. But head injury may occasionally cause Parkinson's in a minority of patients, and it may cause slightly increased risk. But we must not think that head injury is causing Parkinson's. So that is a myth. Mainly it is genetic factors and some environmental factors. There are various candidates, but really I must tell you that the exact cause of Parkinson's disease, why exactly certain brain cells die in a certain crucial area of the brain, is still unknown. And there is a lot of research going on around the world to find out the exact cause of Parkinson's, but this is still unknown in the large majority of cases.
Oh, that was actually quite informative. Another such question is, can a person who has a Parkinson disease exercise? Like, should all those people make exercise as a part of their routine?
Yeah. So I think this is one message that is very, very important for whoever is listening, is that if you have Parkinson's, exercise is one of the best ways to naturally release dopamine. And we know that dopamine is a chemical that is the problem in Parkinson's. So
Right.
everyone, and I think you are a health and fitness, person from the description. So health and fitness is extremely important, especially in patients with Parkinson's. So we encourage all patients with Parkinson's to exercise to the best of their ability, okay, without falling or without losing their balance. Of course, they should, liaise with physiotherapists and their doctors and develop a sort of a fitness program or a physical exercise program. So regular exercise is definitely beneficial for patients with Parkinson's, especially because in any brain disease, but especially in Parkinson's, it has great benefits, and it has been shown scientifically to not only improve physical parameters such as movement, etc., but also to improve cognition, thinking, mood, and anxiety, and these features. So I think we must promote exercise in all patients with Parkinson's.
I'm glad that I asked that question for the benefit of the common masses, because we all laymen would, really don't know what to do in such a case. Also, doctor, does Parkinson is age related? Like it only affects older adults? Is there some relation in that?
Yeah, no. See, generally speaking, Parkinson's happens after the age of 60. Generally speaking, but there is nothing like you cannot have Parkinson's if you are younger. In fact, there are lots of patients in their early 50s, in their early 40s, even in their 30s. Sometimes they develop Parkinson's, and in rare cases, even 20-year-old children can develop Parkinson's. 20-year-old adults. Okay, so these are of course rarer, much rarer, but as I told you, there are some genetic changes which can lead to Parkinson's. So especially in the genetic cases, which are because of an abnormal gene or which run in families, they may be a little younger onset. So this is called young onset Parkinson's disease. And many people have young onset Parkinson's disease. But generally it happens after the age of 60 years. That is most common. But a minority of people may certainly, and we have hundreds of patients with what is called as YOPD or young onset Parkinson's. So a lot of young people can also have Parkinson's.
Okay. So I think this is going to be a little difficult question, because a question like this generally puts all the doctors in a fix. So Dr. Pankaj, is Parkinson's curable? And like, how does the advanced therapy, something like deep brain stimulation, play a role? So can it be completely cured?
So this is not putting me in a fix at all. This is one of the easiest questions there is. Okay.
Okay.
So you asked if Parkinson's is curable. So I will tell you that there is no cure for Parkinson's in the world today. Okay. But having said that, we are quick to also tell our patients there is no cure, but there is excellent treatment for Parkinson's at every stage of the disease. There are good medicines in the early stages, in the middle stages, in the advanced stages. If medicines are not enough or not working well, then there is excellent surgery called deep brain stimulation or DBS, which can take care of patients even in the advanced stages. Okay. So I would say, while there is no cure, but there is excellent treatment available, which really improves the quality of life of patients with Parkinson's disease. So that was one part of the question you asked. I think, so what was the other part?
So I actually wanted to know this only. In fact, we have heard this, that DBS therapy is only for the people with advanced Parkinson disease. So is it right?
Yeah, no. See, generally speaking, it is utilized for patients with advanced Parkinson's, but it is incorrect to say it is only for very advanced Parkinson's disease. In the earlier stages of Parkinson's also, if the lifestyle of the patient is hampered enough, and if the medicines are not really doing their job completely well, then it can be now increasingly considered in the earlier stages of the disease. Of course, there are several points that we will consider in an individual case. Okay, but it can be done in earlier than in the earlier time than was traditionally thought. And there are studies to to show that it is effective in even the middle stages or slightly earlier stages as well.
Okay, great. Doctor, I'm really grateful that you resolve all our myths, and I hope it helps our viewers too. These sessions are actually designed to increase the awareness of Parkinson's as a whole, and I'm sure that this definitely has been a success, especially with that myth busting part.
Yeah, thank you very much. It was very nice to answer your questions. I hope we have busted a few myths at least, and thank you very much.
Thank you for your valuable time, Doctor. Thanks for the entire team. Thank you.